Salam everyone and welcome back to SomaliDispatch.com. Sahra Kaahiye, a Somali Canadian respiratory therapist at the University of Alberta Hospital, was the first Albertan to receive a COVID-19 vaccination this week. Sahra is also the chair of a Somali Canadian Women and Children Association and hopes to inspire the community in accepting the vaccinations. She joined us to discuss those and other issues in depth. Sahra Kaahiye, welcome to SomaliDispatch.com. I'd like to thank you in advance for your time and allowing us to ask these pressing questions, if you will, about the health situations in our community and the community at large. As a healthcare worker, if you can give us an overall view of how things are in terms of the pandemic resurgence and how things look overall.
Well, at the moment, since this last wave has hit post-Thanksgiving, it's been very busy, extremely busy, particularly in the hospitals. They've just been overwhelmed, as well as in long-term care homes as well. Lots and lots of COVID patients. Unfortunately, a lot of them are elderly. And the one thing that I continue to hear from my colleagues is just that it happens so quickly. Somebody can come in and just be slightly short of breath, and then in the next couple hours they'll be on a little bit of oxygen, and then the maximum amount of oxygen, and then they'll be on a machine, and the next thing you know, they'll be on a ventilator and unconscious with a tube down their throat. It happens very quickly, and unfortunately COVID also impacts everybody at a different level as well, so we're not really sure what we're going to get with every single patient. So we're constantly being aware and hyper vigilant, and I know it's been a very, very stressful environment. I was speaking to one of the doctors that I'm friends with, who has just had to sign off on so many death certificates in the last couple of weeks that it's just been like, this was not what she signed up for when she became a doctor.
Right.
So it's been very mentally exhausting, and I'm not going to be surprised if there's going to be a lot of post-traumatic stress after this pandemic is over, and a lot of people leaving acute care because they just are not going to be able to when they sit down and kind of realize exactly what they went through. I feel like there's going to be a lot of mental health that's going to be coming up.
Right. Definitely. A lot of people didn't sign up for this. I think there's a lot of added stress onto providing care, right? On top of that, there's people who cannot come and see their loved ones, and you guys filling in that gap, and it's just been crazy. Hopefully, with the announcement of the vaccine, some of the anxieties are dealt with. If you can tell us a bit about how you became one of the first people in North America, actually, and not just in Alberta, to get the vaccine shot. Tell us how that came about.
Sure. Well, every province had their own method of distribution, who they considered was going to be the first to get the first batch of vaccinations.
Right.
And in Alberta, they chose to have it to be the frontline workers, particularly the respiratory therapists and the doctors and nurses in the ICU. And because I'm a respiratory therapist, I've been one for the past 8 years. My manager informed me last week to expect a phone call from Alberta Health Services to book my vaccine in. And although it's voluntary, they're not really sure how it's going to impact my work if I don't get it, if there's an outbreak, considering we're always on outbreak precautions. We're consistently wearing gloves and mask and goggles at work. So she was like, make sure you pick up that phone call. And I missed actually both the first 2 phone calls. And when I went back to work, all of my colleagues had their appointments booked. Oh, I'm booked this day, I'm booked this day, I'm booked on Saturday. And I said, I'm not booked yet. And they're like, are you not planning to get the vaccination? And I said, no, I'm planning to. I just keep missing their phone calls. And then my manager kind of, slightly kind of said, oh, you better not miss that last phone call, because if you do, you're going to be the last person to get the vaccination. And I don't know how that's going to impact your shifts. So I made sure to pick up the phone call, made sure to put the phone on loud. And they're like, we have a spot available today. And so I agreed to come in that day, just 3 hours later. And then they called back and said, are you all right if media is going to be there? And I said, I'm fine with that. Okay. And then they called back and asked for Alberta Services Instagram and for their Twitter. And then after the interview, they asked me if I could be the first person. At the time, it was supposed to be in just Edmonton.
Right.
It wasn't until I had reached the place and had been in line that the nurse next to me had whispered that, by the way, you're going to be the first in Alberta. And then that's when I kind of realized what this would mean in terms of exposure at that
Right.
point.
You became the poster child.
Yes, exactly.
Yes. So, a person of color and a female and a hijabi and all of these also add to that, right? The optics of it. Which medication did you get? Did you get the Pfizer or did you get the Moderna?
I got the Pfizer one, correct. So the Pfizer one is going to be a 2-stage. So I got the first dosage, and then in 28 days, I'm going to be getting the second one.
So having taken the first dosage, how do you feel since Tuesday?
Well, normally when I get the standard yearly flu shot, my arm burns and it's sore, and I just kind of feel like a little bit of numbness there. This one actually didn't hurt. Yeah. Which was surprising to me. I felt a bit sore that night and the next morning, but the soreness has completely disappeared. I was telling one of my doctor friends that I could feel my immunity building to something, so I could tell that the vaccine is working. Without getting technical details, let's just say that there are certain signs and symptoms of my body that I recognize when my body is fighting off something. So that really made me happy to know that it means that the vaccine is working and my body is building antibodies and some form of immunity.
That's a great segue for my next question, because a lot of people think with the vaccinations and the medication available now, everyone feels as though we're over the pandemic. Tell us a bit about what it means to have a vaccine and what we need to do to continue to flatten the curve as it was.
Well, we have to first remember, and I've said this many times, that the vaccine is not a cure.
Right.
What it's doing is preparing our own bodies to fight off whatever infection that we may contract, in this case, the COVID virus. So we have to remain vigilant. We have to continue washing our hands. We have to continue keeping our distance and wearing masks, at least until everybody has a baseline immunity. And they anticipate that's if 70% of the population is immunized, which is best case scenario. So we have to remember that it's not just going to be we're all getting these vaccine shots and then it's going to go away. These vaccine shots are making it so that our bodies have the ability to fight off this virus should we contract it. It's not fighting off the virus itself or for us, if that makes any sense. So, after this Christmas season coming up, we're also we are anticipating another wave of cases, particularly from people after we had the Thanksgiving wave. Right. And so you have to remember that the virus is still out there. There's still a lot of cases. There's still a lot of people who don't show symptoms, asymptomatic, who are carriers, who can be carrying and spreading this virus. Right. So even if you get the vaccine and then you get the virus and you don't really feel much because your body has been able to fight it off, best case scenario, you could still be contagious enough to spread that to somebody else who has not gotten the vaccine or who is immunocompromised, and they might not be able to survive. So we have to kind of tap into this neighborhood mentality. Don't just think about ourselves, we have to think about our family, our neighbors, our friends. We have to think about the people around us. And until we are given that this vaccine, the curve is flattened, we have to maintain being vigilant.
Right. If I may ask you one more question about the vaccine and the history it has in North America, at least with visible minority communities, be it them being, at the end of the line getting it, or being the sacrificial lamb as it was. There's a lot of conspiracies out there, and there's a lot of bad history with vaccines in North America. What would you tell people to ease their anxiety, if you will, about the vaccinations?
Well, firstly, I understand the distrust completely. Exactly like you said, historically speaking, minorities, Black people, as well as Indigenous people have tended to be the test subjects or the guinea pigs for these things. And so I understand the distrust towards the government. At the same time, we also have to remember that we don't have diseases now because of vaccines. And our generation, it's easy to forget, but people who are older than us might remember the polio and tuberculosis, and these ravaged people, killed thousands and thousands of people. And that only stopped because of the vaccine, because the vaccine was able to flatten the curve and able to build enough of immunity in the population that we don't see polio to this day. At least it's very, very rare.
Right.
So that's what we have to remember, that the vaccine is one of the most modern day public health interventions that has saved millions of lives. And although it does have a shady history, and I agree with that, and although I also agree with the second stage of what you were saying, that they tend to be at the end of the line, that we have to remember that this is hopefully a new era. And I think that myself getting this vaccine as one of the first people is an indication that this is a new era that we're stepping into. This is a new generation that we're stepping into. We also have to remember that the vaccine is not a new concept, and the reason we don't see diseases now is because of this vaccine.
Right.
Could I also further add, without again getting too technical, that the reason this vaccine was quote unquote developed quickly was because of some technology that's been in the works since the 1990s that they've only been able to put into play with this vaccine. And additionally, they've had so much cooperation at so many different levels, the pharmaceutical, governmental levels, intergovernments, so worldwide cooperation. And I believe that that is one of the reasons that we've had this vaccine produced so quickly, not because they've cut corners, but because of all the intercooperation and because of the new technology.
Right. As someone who is well in, works with respiratory compromised individuals, and being a therapist, a respiratory therapist at the University of Alberta Hospital, you also do some work with the community, the Somali community in Edmonton, Alberta, Canada. What can you tell us about some of the work that you do with them and that they do for the community?
Sure. Thank you again for that question. I've been a volunteer for the Somali community for most of my life, particularly because my family has raised me to be a very important role in the community and to make sure that I'm always giving back. At the moment, I am the chair of the Somali Canadian Women and Children Association, or the SCWCA. And though they specialize in family violence and in women and children's programs, we've also kind of connected with Canada Home Care Group, which is a organization that allows doctors to come to your home in Edmonton, which is a fantastic initiative, because especially we understand the Somali families have a lot of children, and sometimes transportation is very difficult. And there's been more fear to go into clinics, go into hospitals because of COVID as well. So the ability for these doctors to go into the houses and to take care of them and their homes has really been something we thought would benefit our community. And so we've partnered with them to run vaccine clinics, and we're also hoping a vaccine clinic as well out of it.
That's great. I think women and children are integral part of the Somali community, and didn't always, in terms of services from the community itself, we're not at the forefront, even though they always were the backbone of society. And I applaud you and your colleagues for specifically catering to them, if you will, and targeting your services towards them. I'd like to thank you for your time and your expertise in this manner, and being and taking the graph up, if you will, because it's especially in Alberta these days, a positive stories like yours don't usually make the headlines, and for you to do that for the community at large is a welcome surprise, and I thank you again. Thank you for your time.
You're welcome. Take care.
Take care. Bye. Alaikum salam.